Kershaw's and Dr. Bill Wade's assistant. And we are here today talking about their forthcoming book, Brain Change Therapy, Clinical Interventions for Self-Transformation. Before we get started talking about your book, let's talk a little bit about your personal backgrounds. Dr. Kershaw, you want to start?
Sure. Well, my family was fairly poor when we grew up, but actually I didn't really know it, which was probably really helpful to me. My father was a pilot during World War II, and he had a lot of pent-up feelings about that experience. He probably had post-traumatic stress disorder his whole life and was not able to really fully work that through. So that provided some particular challenges for us in the family in terms of the way we communicated with each other. On the other hand, that probably fueled my interest in psychology as I was really curious about being able to enjoy living a life and living in what we might think of as a land of possibility rather than limited ideas about what we could potentially do. In addition, my parents were very supportive of me going to college, and I was the first woman in our family to get a college degree, much less go to graduate school and become a doctor. So I really did appreciate their support about that. It's been something that opened many, many doors for me in my life.
As with Carol, my father also was in World War II. He was a career naval officer, and there are two things that probably fueled an interest of my going into behavioral sciences or psychotherapy. One, as a small child, I was pretty severely asthmatic. And while my parents took very good care of me, I never developed an identity that I was asthmatic or that I was any different from any other child. And I really am glad that my parents did not put that identity on me. I did everything that every other child could do. What that did, I think, ultimately was to give me the idea that, so I had a hard time breathing, we just dealt with it, yet the possibilities were limitless in terms of what else I could achieve. The other thing, because we moved around quite a bit, and we lived in Shanghai, China before the Communist Revolution, and as well as other places throughout the United States, I developed a fascination for other cultures, other families, the way other people solved problems, and realized there wasn't just one particular way to do something. And that also, I think, helped me develop an interest in people, in how they solved problems, and finding new and unique ways to deal with issues that needed to be resolved.
Okay, well, as I mentioned before, the title of your forthcoming book is Brain Change Therapy, Clinical Interventions for Self-Transformation. There are many wonderful ideas in this book. How did you develop the ideas for this book?
Well, you know, we've been working on this book quite a number of years, and we were fascinated to get into the literature in neuroscience, and the recent discoveries the last 5 years have been pretty remarkable. We began to understand that psychotherapy with the brain in mind could be much more effective. But we began to ask ourselves, what might be the common denominators among all the different schools of psychotherapy? There are many approaches that work very, very well. But we thought if we could identify what these common denominators were and focus on those, we might very well be able to speed up the process of psychotherapy and have it be even more effective. And we discovered that, in fact, that is the case.
Carol mentioned the last 10, 15 years, neuroscientists have been able to look into the brain much more deeply than they had prior to that with the advent of the functional magnetic resonance imaging device. They could look into the limbic system. And what they found was that different techniques, different schools of psychotherapy actually made changes not only in the operation of the brain and the function of the brain, but also there were ways that you could actually change structures in the brain. And so that fascinated us as well. And so in our book, we include a number of techniques and technologies that actually have been shown through research to change how the brain is operating and also how the brain is structured.
Okay, can you talk a little bit about what you mean by power of the mind?
In 1964, Herbert Benson, who was associated with Harvard Medical School, took a film crew to the Himalayas, and he filmed Tibetan monks meditating. What was fascinating was the dead of winter, they were meditating outside, sub-freezing weather in the snow. Now, Benson's film crew was wearing parkas and all the cold weather gear that you needed to have to keep from developing hypothermia. The monks were wearing little more than wet sheets. Not only did they not develop hypothermia, they dried the sheets. He actually filmed steam coming off of their backs. That's tremendously fascinating and powerful when you look at focusing attention on warmth and how that changed their physical reality. Now, that's not something you learn in a weekend workshop, of course. But at the same time, you begin to look at, well, we think that we're going to freeze to death if it's cold outside. For these monks, that wasn't the case. And it was all had to do with their mental activity.
And as a matter of fact, we know that now where a person focuses attention really creates possibilities, or it shuts down to a person's ideas of limitations. So not only can we change our physiology with how we focus, we can slow our heart rate down, we can increase our body temperature or lower it, we can lower blood pressure with how we focus. We can do a variety of things, and so it's pretty amazing. When people learn what they actually can do, it opens up many doors to them of what possibly they could create in their lives.
That is fascinating. You also talk about self-regulation in your book. Just what is self-regulation and why is it so important?
Well, self-regulation is the ability to do things like hold certain thoughts in your mind, move into certain states, emotional states, use your ability at being persistent to accomplish a goal. If you're trying to lose weight, follow through on that goal, follow through on that behavior. We know that people who are the most self-regulated are probably the happiest people in the world. So there are ways to learn how to become more regulated and more balanced. And this is what we talk about in the book about how to do that.
We're not talking about repressing feelings or suppressing feelings, but really being in touch with a person's feelings and responding appropriately. Let's take an example of a person becoming angry. A lot of times people will think that they need to express the anger in a reactive sort of way. The reality is their reaction may make the situation worse if they're able to notice the feeling and understand the feeling and then make a decision. Do I want to express this feeling, and how do I express this feeling? Then they can communicate much more quickly and also much more effectively and in a way that solves the problem that is at hand. There's also a tape of a woman who is dealing with pain. She's having a C-section and she's under hypnosis. And she's able to control the pain. So she's regulating emotions and she's regulating her physiological processes at the same time.
In fact, Bill and I really believe that a long-term goal is to develop a non-reactive mind, because those people that can spend less time in emotional reactivity have much more control over their own lives. And so with some of the processes we suggest in our book, it's really possible to learn that.